physiotherapy approach of using different or combination of skills to cohesively manage a lymphedema patient optimally. So we're going to talk about number 2 only. That means we will stress on what a physiotherapist can use to use as a treatment for
This is the person that you said you want.
Hello? Hello?
Can hear, madam. Continue.
Yeah, sorry, I'm sorry. The line just cut off. I don't know what happened. I just got in again. Okay, so we're going to look at how the PT manages a lymphedema patient. And now I have a problem. I cannot go to the next page. Okay, so the lymphatic system, everybody knows about the venous circulation and the arterial circulation, but very few of us actually pays attention to the lymphatic system. And we know that the lymphatic system is the unsung hero because they play a very important role and not many of us pay attention to this system. Okay, so first let us look at what is lymphedema. Lymphedema is the abnormal accumulation of protein-rich fluid in the interstitium, which causes chronic inflammation and reactive fibrosis. Okay, so how does this come about? Usually what happens is that the transport capacity of the lymphatic system is insufficient to remove the normal load. Okay, and this increase the interstitial colloid osmotic pressure and cause an imbalance in the microcirculation. Now the increase in the filtration out of the capillaries of this fluid will eventually lead to lymphedema. Okay, so what is lymphedema? We know now where can lymphedema happen? It can happen any parts of the body, especially in the extremities and in even genitals and even the face, head and neck. And lymphedema, as we know, is very common post-operative mastectomy, and the complication of post-operative mastectomy is lymphedema. The incidence can range from 5 to 83%. Now, about 71% eventually develop secondary edema within 12 months after surgery. And as compared to primary lymphedema, it is only about 1 out of 6,000. So the integrated approach of lymphedema management, in summary, we can use the non-invasive physiotherapy management, or there is this surgical treatment. First, in non-invasive physiotherapy management, we have what we call the decongestive physiotherapy, or other people call it CDT. That means complete decongestive therapy, but I would like to call it CDP. And we can use pneumatic compression therapy, and there is this negative pressure cupping therapy, taping, and also laser therapy. Now, we will not mention the surgical aspect. So what is the gold standard? We know that the cornerstone of managing lymphedema is CDT or CDP, and it is proven as the most effective conservative management for lymphedema. Now, many different schools actually offer different approaches. For example, you have the Wody, Foldy, Casley-Smith, Close, Chinkley, and etc. So there is two phases to the management of lymphedema. We call it the First phase, the intensive phase, which leads to the self-care phase. Now, the intensive phase, there will be a CDT done several times a week or even on a daily basis in severe cases. And the duration of treatment depends on the severity and the compliance of the patient. And the next phase, after we have completed the intensive phase where we have achieved the size of the limb that we want, we go to the self-care phase. And here we will do the self-MLD, wearing garments in the daytime, bandaging at night. Patient has to exercise daily and they have to take care of their personal hygiene such as skin and nail, and also comply with the follow-up visits to the physiotherapist. Now, the two-phase therapy, as this is presented by post-training, this diagram, we have phase 1, which is the decongestive phase, and phase 2, which is the maintenance. Now, in this phase, you will find that there are things that need to be done accordingly. Following this treatment, you have to do MLD for the patient. Then we have to do bandaging, teach the patient exercises, and then self-care and wound care if there is any wound. So the patient will have to follow with the maintenance phase exactly what we will teach the patient here. So the 5 elements of complete decongestive therapy is one, like I say, manual lymphatic drainage, where the patient will go through a process of massage for following the pathways that has been proven that is effective. Then is followed by compression therapy. Then the patient will have to follow a regime of exercises, and then skin care and nail care, and patient will have to do self-massage at home. Now, there may be other services which the therapist can get the patient to get these services, such as nutritional or psychological counseling. So first of all, we will look at MLD or manual lymphatic drainage. Usually it lasts between 45 to 60 minutes per session. And the MLD, the aim is to increase the lymph angioactivity. That means we want the lymph to move fast, to increase the reabsorption of the protein-rich fluid back into the circulation, and then promotes relaxation and creates an analgesic effect. This is the effect of manual lymphatic drainage. And the manual lymphatic drainage, they have specific pathways that we have to follow. Like for example, this is for the upper limb and this is for the lower limb. This is one of the pathways. So the physiotherapists have to do a proper assessment of the patient and decide where they're going to drain the lymphatic fluid. After the drainage, the patient will have to go through lymphedema bandaging, and this is an external factor which will help to improve the lymph vessel pumping, and it will reduce the filtration rate, improves the efficiency of the muscle and joint pumps, and it will prevent refilling or reaccumulation of the evacuated fluid. And certain techniques can be used to break down deposits of indurated tissue. You may find that if the tissue is very fibrous, very hard, you will have to find a different technique to break down the deposits of this indurated tissue. Compression alone does not adequately treat lymphedema. I know that there are some therapists or some therapists who just bandage the limb and ask the patient to go home without going through the proper procedure. It is not correct, okay? After compression, we have to continue with the next step, right? That is, you have to teach the patient exercise. The exercise will increase the muscle and joint pump. Then it will lead to the venous and also the lymphatic return. Now, this is performed usually with the compression bandage on or the patient wearing the compression sleeve or garment. The exercises will be active range. There will be some strength and stretching, and always include diaphragmatic breathing. We know that breathing is actually one of the intrinsic factors which helps to pump, okay, the angiones, the lymph angiones, to increase the lymphatic flow. That's why all the exercises must include a lot of breathing. And how much should the patient do? The exertion, the pace, and all this is patient specific. We cannot have a recipe that fits all patients. That means we have to assess the patient and decide how much the patient can do. Now, exercise, like I say, using breathing can stimulate the lymph flow and lymphatic drainage. It acts as a lymphatic system pump, moving the sluggish fluid and enables oxygen to get into the tissue and induce relaxation at the same time. Remember, when it is very congested, the tissues are actually deprived of oxygen as well. So functional activities is incorporated. The patient is encouraged to carry out functional activities, okay, after graded support has been given. And this support means the sleeve or the bandage, okay? And this is a picture of my patient where her daughter is assisting the mother with the exercises. So a lot of patients usually ask, can I exercise? Is my exercise supposed to be vigorous or supposed to be light? And some of the doctors tell the patient, you cannot exercise. You know, if you exercise, your limb is going to get bigger. So we're going to prove that actually the patient can exercise. Now, this is a study done and published in the Journal of Surgical Oncology. Breast cancer survivors actually involved in the dragon boat race. 20 participants were all breast cancer survivors, and 13 of them actually has presented with lymphedema. They wore compression garments during the training and they trained for the competition for months. Now, after the training, none of the women showed clinically significant difference in the arm circumference. This means that rowing is vigorous or very tough, and still there is no increase in the swelling of the arm. So this is a group of those patients. They will wear their sleeve and do their training, and there's nothing wrong after the training. Now, weightlifting, again, heavy. The doctor tells the patient, you do not lift heavy objects and all this. And this is another study. Women were all cancer-related lymphedema, that means BCRL. And this is a 1-year controlled double-blind study and involved 141 participants. Now, at the end of the weightlifting, that is 1 year, there is no significant effect on the limb swelling, and it resulted in decreased incidence of exacerbation of lymphedema, reduced symptoms, and increased strength. So you see that exercise actually do benefit lymphedema patients. So our treatment, our approach is we should always include exercise. The next one is skin and nail care. We know that this is very important because we want to reduce the incidence of infection. Now, if the patient do not keep the skin supple and the nails properly cut, they may get an injury. And if you have an injury, they are prone to get cellulitis. And if there is cellulitis, you know that it will increase the swelling of the arms. I have many patients, each time they come with the cellulitis, the arms actually increases in size. So we must make sure that we teach the patient what the patient is supposed to do, and we always warn the patient. If you end up with a cellulitis or infection of the skin, the first thing you should see is to go and see a physician and get a course of treatment. Otherwise, the cellulitis can be very risky for the patient if the patient gets sepsis, okay? So we have to make sure that the skin and nail care is properly taught so that the patient will not have recurrent cellulitis. Okay, the next one is instruction of self-care. The nail care we have already mentioned. We have to tell the patient that infection prevention is very important. The patient for lifelong, they have to continue their self-bandaging. They have to practice how to put on and take off their compression garments. We call donning and doffing. And then the exercises have to be performed regularly, and self-MLD has to be done daily as well. And also stress to the patients the importance of follow-up visits. Now, this is a glove that the patient can use to help them to wear, because it is very difficult to pull this tight clothing up or compression garment up. So they can actually use this glove to help them to put on the compression garment. Okay, now these are some of the techniques that we will teach the patient, how they're going to do their breathing, how they're going to do their self-MLD, different areas. This is the supraclavicular, this is the axilla area, and this is the abdomen. These are some of the examples. Then next, the patient will be taught how to do bandaging at home every night before they go to bed. Okay, and this is bandaging that is done by the patient, which I think is very wonderful because the patient is able to cope. So a patient will have to comply with all these rules. So we have finished the self-care. We have come to the other treatment modalities. Okay, now it can be used, these treatment modalities which I'm going to mention, it can be used by itself or as an adjunct to enhance, to shorten the time, to maximize manpower, or to empower, to use as an empowerment tools at home care. Now, here I would like to caution that as a physiotherapist, you have to use your wise judgment whether you can get the patient to use certain tools at home or not. We have to be very careful because we do not want the patient to end up getting increase in the limb size or getting infected or some kind of compression on the nerves. So we have to be careful. After proper assessment, clinical reasoning, and critical thinking, then you can decide to use any of the tools that I'm going to mention next. Okay, taping for lymphedema. Now, taping has been used by many CLTs and therapists, and it is used as a decompression effect. Okay. Now, taping has a positive effect on the musculoskeletal system and the vascular, lymphatic, and also neurological system. We know that. Okay, and it helps to reduce pain and facilitate improved blood and lymphatic circulation. So for lymphedema, we are going to make use of the decompression effect. So when we want to do decompression, we must never use rigid tape because rigid tape is going to apply compression, going to cause compression on the enlarged limbs. So we can use kinesio tapes. You can use any brand. Don't have to use expensive one. You can even use the cheapest one. Okay. The taping techniques involves the application of elastic adhesive tape to the skin, providing therapeutics that are local and direct as well. Direct means through the reflex pathways. Now, the tape application technique causes folds in the skin to form during the body movement. And these folds lift the skin and facilitate lymphatic drainage and encourage blood flow. Through the application of adhesive elastic tape with specific mechanical and elastic properties, it provides mechanical stimulation capable of creating a space within the tissue. And this is very important because this space will promote cell metabolism and activates the body natural healing mechanism at the same time. And this tape will stay on until the next bandaging session. So if you look at this picture, we want this rippling effect when you apply the tape on the skin. The ripples will lift the dermis and epidermis, giving it a decompressive effect underneath. Okay, so if there should be no pressure on the sensory nerve fibers, and this will increase the lymphatic drainage and improve the circulation. So if you look at this picture, you look at this blue one is the venous system. It is compressed because of the inflamed muscle, the chronic inflammation that's there, the swelling that's there. It compresses on the blood vessels and cause a compression here. Okay, so the skin and fascia, there is compression because it's containing within a cylindrical surface, and this will compress the blood vessels, compress the lymphatic vessels, compress even on the pain receptors. But after we apply the tape on the skin, the ripple action will cause a lifting effect. Okay, so it will lift, and what happens is that you can see that the lymphatic vessels is now dilated, the blood vessels dilated because there is no more pressure on these structures. So that is one of the effects of taping on lymphedema limb. Now in 2007, when I was trained, we were also taught how to do taping for lymphedema. But taping along the years have keep on advancing, and we find that now with this rippling effect, it really is very effective, and you can see the swelling of the limb down. But we use this in combination with CDT as well. If the limb is enlarged and fibrous, you find that only using taping is not going to be effective. So this rippling effect, when you remove the tape, you can see that there is erythema, and this is immediately after remove. You can find that there is a lot of improvement in circulation and reduction in swelling. So for this patient, you can apply this tape before you bandage the arm. Okay, the next one that we can use is pneumatic compression pumps. Okay, this one I'm showing you is the traditional pump. Now, the use of traditional pneumatic pump is very controversial because at one time they say that you're not supposed to use because there is a risk of proximal. That means if you do for the arm, all the fluid will be pushed to the chest, the neck, so the patient will get swelling of this upper trunk, the neck, and the face. So there is this risk. And if it's the leg, what happens is that all the fluid will be pushed to the abdominal area, to the genitals, and the patient ends up with abdominal and genital swelling. But some studies do demonstrate improvement in the patient's condition. But we have to look into this risk of proximal swelling. But lately, we find that they have improved on the pneumatic pumps, compression pump, and you find that they include the body area, and for the leg, they include the hip region, where they will increase the pumping from this region to prevent congestion. And we find that if you were to do a proper MLD, open up the tributaries, drain the fluid first, and then apply the pump, it is effective. So if you look at this study, it is too small for you to read, okay? But this is the different study that has been done. They use the regime, the pneumatic compression device regime, the pneumatic compression type, and then the lymph volume reduction, the erythema volume reduction, and the circumference reduction. Now, all these studies were done, and they find that many of them actually shows a lot of positive results. Right? So it's very long and it's a very blur. I'm sure you can't see it, but I'm just showing you that it has been done and it has been proven positive. So this is published in 2016. So the conclusion of this study from 1990 and 2016, this review found that there is significant evidence that PCD does help to reduce the lymph volume for both the upper and lower extremity lymphedema. However, the QOL is not confirmed that there is any functional or QOL benefits. PCD treatment leads to reduced healthcare resource utilization. Like I say, you have to spend about 40 minutes or 30 minutes massaging. But if you find that the patient uses PCD and it helps, of course, it helps to utilize your resource. And then it has been found to reduce episode of cellulitis, but it is uncertain whether PCD can effectively replace or supplement CDT. So we find that at the end, CDT actually still provides the best treatment because nobody can certainly say that PCD can replace CDT. Then the other one that has been used a lot lately is the laser therapy. Okay, a definitive benefit has not yet been established, but based on literary review and clinical experience, some clinicians actually do report that there is a reduction in fibrosis, elevation of pain, and improved lymph transport. Now, there are some studies which has been done and prove that they actually stimulate lymph angiogenesis, that means encourage the tributaries to form, and then encourage lymphatic motility, that means they become more active and move better, and reduce the lymphostatic fibrosis. Okay, so the result shows that there was a reduction in lymph volume in the group with LLT as compared with other treatments. That means they use LLT for this group. Okay, and then the other one in the Journal of Cancer Survivorship, it says that there were greater reductions in the volume were found with the use of LLT than in treatments without. Okay, So LLT confers clinically meaningful reduction in arm volume and pain in women with PCRL. So some of the research has already shown that you can use laser therapy. Now, again, this is the table of systematic review that was mentioned just now. And you find that here, the outcome is that they used the volume parameter of the affected limb is measured, pain is measured, okay? And they use a score. And they find that after 2 cycles, significantly, the volume of the limb has reduced. And here, again, reduction of the affected limb here was by 31%, you know, and this one, significant reduction in the volume again. So if you can look up on laser therapy, you find that there are quite positive evidence on LLLT. That means is low level, okay? There is no mention on high level laser therapy as yet. And the next one that we're going to look at is pressure cupping for lymphedema. And this actually is has been used quite a lot in US when I was there doing for my certification course. Now, cupping using negative pressure to promote the lymphatic drainage, loosen the adhesions and reduce the fibrosis, okay? Now, this technique is created to mimic as near possible the MLD techniques, you know, like the pressure that they are supposed to give, the time that each suction is done. It is as close as possible to the manual lymphatic technique that we do. So this is the latest machine that you can find in the market. Now, this cupping uses negative pressure, and this negative pressure will lift the skin, like the taping technique, the kinesio taping technique that I mentioned just now, and it will spread and decompress many layers of the tissue to effect the limb, blood, fascia, muscle, skin, and it also helps in the scarring as well. That means it will lift and decongest this area and help to improve the lymph flow. So this is another study in the World Journal of Acupuncture. Now you find that the next 2 study I'm going to do is actually a lot like a traditional medicine, okay? So the conclusion is that compared with CDT, the sliding cupping along the meridian combined with short stretch elastic bandaging wrapping. That means you have to continue with your CDT wrapping in the treatment of this one, and it was proven more effective. That means they will do the cupping first, and then they will do their CDT. And this one is another one that is conducted in China, Beijing, University of Beijing. Okay, 75 patients, and they do cupping and blood letting. Okay, this is just for your knowledge. Please do not practice this if you are not taught. And I think it can be very dangerous because patient can get infected and get cellulitis. So I'm putting this to let you know that there are other modalities that we can use besides massage or MLD and all the other features that follow MLD. So this is only for your knowledge, okay? So the first group is they use cupping and bloodletting and acupuncture and exercise, and the second they use exercise alone. Now you find that many physiotherapists are actually very good in acupuncture and dry needling. So you may think that you want to apply for lymphedema, but I will advise caution about this, okay? This is only for knowledge. I want to stress that I do not think that we should do if we are not sure. Okay, the results is that after 50 days of treatment, you know, the mean reduction was this, and you find that compared with the control group, the treatment group had significantly greater reduction in the arm circumference. Okay, now you find that p-value is significant, right? No patients in either group experience any adverse event. That means they were lucky that none of the patients actually get cellulitis of the skin. Okay, so caution when you want to practice this, or you think that you are very good in acupuncture, you want to do this, please be careful, right? Now, this is also for knowledge. You know, Jessica's symptoms, right? She has swelling of her limb which is actually not lymphedema, but edema. Since this is published, I just want to share with you. And she has applied cupping to her swelling edema limb. And she has shown her picture. This limb was when she was doing cupping, and this was after the cupping, and the result, she says, was very wonderful because you can see almost immediate reduction. Okay. Now, for your information, edema, if you were to do elevation, it will reduce by itself, right? So this is just for your knowledge that even film stars, knows how to use cupping as well. So this is the cupping that she put there. Okay. Now there are others that is in the that you can do. And massage oil. They believe that ginger oil improves lymphatic drainage. Again, you have to look up for evidence-based because all of us actually practice evidence-based practice. So be careful if you want to use massage oil. Patient actually, I just heard from US that the CLTs do practice this, right? Use aromatherapy infusion, like for example, lavender can relax and reduce depression and anxiety, and therefore help the lymphedema patient a lot. And lemon infusion actually causes anti-inflammatory in the system. And we know that in lymphedema, there is chronic inflammation going in the body all the time, okay? So if you want to read further, you are encouraged to read and know, because this, you know that our US counterpart are practicing this, and Compression Guru just gave a session on webinar on aromatherapy and all this. And I just finished the session with them, and they are using all this together with their CLT. They are all certified lymphatic therapists, okay? So whatever that is mentioned here, as a therapist, please remember we practice evidence-based, and remember the patient's safety is of utmost importance. If you want to practice something which you think you are not very sure, or you think will cause more harm to the patient than good, please stay or go back to the traditional CDT or CDP. Okay, that means you do your MLD, you do your bandaging and all this, but forget about all these techniques. But if you are very good, you are very well versed in all these, you have gone for all your training, you are certified, by all means, you can see if the patient will benefit. Like I say, treatment of patient is not a single recipe where you can put to all the patients. Every patient is unique and is individual. That means you have to assess the patient and you have to know exactly what you want to do for the patient. So my take-home message for all of you is that integrated management of lymphedema, either post-mastectomy, secondary or primary, has been shown to produce results, okay? So that means it's not that my treatment is the best, your treatment is the best. No, there are many ways that we can approach the patient. Decision to approach the on combination method, okay, is based on thorough assessment and good clinical reasoning. Why am I doing it? How is it affecting the patient? What is the outcome of this treatment? We have to ask ourselves, what will happen to the patient if, something goes wrong? You have to go through all this reasoning before you really treat the patient well, okay? And very important is that the therapist must be credentialed to treat, and the use of all the skills that we mentioned. So that means if you are not a certified lymphatic therapist, you have never been taught and you want to just bandage, be careful. Yes, I have received a patient referred from another hospital because of the tight bandaging, compresses on the nerve, and the patient comes with a wrist drop. Okay, so we have to be careful. You have to be credentialed. And CDT has been proven, okay, with the strongest scientific evidence. This is the best, the gold standard, okay? Combining it with other techniques like pneumatic compression has demonstrated higher efficacy. Okay? This is what is found in the research. And laser and electrical modalities have not yet been extensively researched, but a lot of clinicians have found it to be very useful. So this is, today is food for thought. What I have spoken about is food for thought, and you have you can think whether what has been mentioned is going to be helpful and useful for your patients. Okay, so I have finished my session because I'm given about 45 minutes because you need some time for Q&A. Am I right, Sri Kantan?
Yes, madam.
Okay, so in case you do have any questions that you need to ask, but you're not able to ask today, please feel free to send me a message at my email. All right. So if you have any question, I do not have the chat bar here, so I don't think I can see whoever is there. I mean your chat. So if Kantan, you can see, you can please read to me the question that they have.
Sure.
Yeah.
Okay, thank you very much, madam, for your short and sweet session. Um, for the information of all the participants, Madam Sufan is conducting some workshops also on integrated physiotherapy management. It's a 10 days course. If anyone interested, you can contact her directly or contact us. We can help you through. Now, if you have any questions, you can put up your questions. You can put up in the chat.
Okay, let me clarify a little bit. Okay, I am actually trained to be certified. I'm a certified trainer, but I'm attached to a company in Malaysia. So I am actually their trainer. If you need to train in Malaysia, we have to go through this company, right? This is just to clarify that I am not an independent trainer, right?
Yes. Okay, we have a question from Madam Shu. How do patients shower with bandage on?
Okay, if it is the arm, then you use the shower head and you have to lift the arm. But what we do is we tell the patient, do you know this black sampa bag, the what do you call it? The waist bag, black color, very big waist bag.
Yep.
I do is I tell the patient to put the arm into this black waist bag and then put tie a string on the upper arm, and then the patient can shower. Okay, but the arm should not be wet, so they have to use this means. Now, if it is the leg, what they can do is they can lift the leg higher and they will try to shower the body, excluding the leg that is bandaged. We do not want to wet the bandage because the patient has to wear the bandage for 23 hours. That is, if you see the patient daily, so you cannot tell the patient that they can wet the bandage, because this wet bandage will cause fungal growth or whatever on the skin. So the patient will have to keep the bandage dry before they come to see you the next day. Or what I do is actually I ask the patient to come, I remove the bandage, then I tell the patient to go to our shower room and shower, because they need to shower. So when they are showering, I just roll up the bandages, and when the patient gets in clean and fresh, we start the next bandaging. Okay, this is some of the recommendations.
Okay, we have one more question from Madam Shua. May I know, is there any lymphedema course available in Malaysia?
Yes. Okay. Now, Budi Penyayang is organizing lymphedema course. This is a certified course, and your certification will come from USA. That means from close training lymphedema certification. And close training is actually very famous in Europe, in Germany, and in America. And when you are certified by them, that means you are an international certified CLT. So in Malaysia, we have, and if you are interested, you can contact me. I can give you the contact number, and you can actually contact them for the next training, which we are going to do again in Malaysia.
Okay, as the time running out, maybe we have one more question for today. This question is from Madam Nadia. How long need use bandage combined with taping during day?
Bandage during daytime. Okay. I think we have to be clear. The bandaging done by the therapist in the intensive phase, okay, is patient has to be on the bandage for almost 23 hours. But the bandage in nighttime is done by the patient. Okay. So how long do the patient wear the bandage? Like I say, the patient will wear the bandage before the patient comes to see you. But if the patient lives very far away, like for example, he has to take maybe 2 hours to get to you, I will tell the patient to remove the bandage when they reach you, because with your intensive treatment and you were to leave the arm free for a long period of time, refilling will actually take place. So then during the initial intensive phase, the patient has to be bandaged either every day or alternate day, depending on the severity of the lymphedema. Okay, but the bandaging at night, the self-care, the patient has to do it every night before she goes to bed, and take off in the morning and change it to a compression sleeve or compression garment. Is that clear?
Yes, I think so. Okay, we don't have much time, so if any questions are there, you can directly email to Madam Sufen. Her email ID, it's in the screen. Thank you very much, Madam Sufen, for your time and your kind heart to accept the
You're welcome.
invitation.
Yeah.
And I thank all the participants who joined for this session. And I want to inform that we will be having another webinar session on radiography, especially for physiotherapist point of view, interpretation of chest X-ray, all these things. Dates will be announced soon. Thanks for your time. Thank you.
You're welcome. I hope you all learned something.
Yes, it's very informative, madam. Thank you.
Thank you.